Knee cartilage covers the ends of bones, providing cushion between bones to ensure smooth movement. But when knee cartilage is damaged from an injury or daily wear and tear over time, it cannot properly perform its usual function, and it doesn't heal on its own. This means your cartilage injury could get worse as time goes on, leaving you with more pain and limiting your ability to be physically active. That's where MACI comes in. MACI uses your own cells to repair your knee cartilage damage. During your arthroscopy, a procedure to look inside your knee, your surgeon will take 2 to 3 pieces of healthy cartilage, each about the size of a Tic Tac, and send them to our state-of-the-art facility. Here, the cartilage cells will be treated to help them expand and multiply. At the facility, your cells are placed onto a special membrane and then delivered to your surgeon for your procedure. The membrane can be customized to match the size and shape of your cartilage defect before it is affixed to the damaged area of your knee cartilage. Your cells detach from the membrane, combine with proteins in your knee cartilage, and form a repair tissue. This repair tissue continues to mature over time, filling your defect to regenerate the damaged cartilage. Unlike microfracture, which requires drilling into bone, the MACI membrane allows your own cells to regenerate and fill your cartilage defect with durable repair tissue, much like that of your original healthy cartilage. This can help you gain back a greater range of motion and reduce your pain. During the maturation process, you will begin a physician-prescribed rehabilitation program, specifically designed for you. As you progress through the program, you should begin to experience restored knee function, helping you get back to being active.
Indication: MACI, autologous cultured chondrocytes on porcine collagen membrane, is made up of your own autologous cells that are expanded and placed onto a film that is implanted into the area of the cartilage damage and absorbed back into your own tissue. MACI is used for the repair of symptomatic cartilage damage of the adult knee. The amount of MACI applied depends on the size of the cartilage damage. The MACI film is trimmed by your surgeon to match the size and shape of the damage to ensure the damaged area is completely covered. Limitations of use. It is not known whether MACI is effective in joints other than the knee. It is not known whether MACI is safe or effective in patients over the age of 55 years. Important safety information. MACI should not be used if you are allergic to antibiotics such as gentamicin or materials that come from cow, pig, or ox, have severe osteoarthritis of the knee, other severe inflammatory conditions, infections or inflammation in the bone joint and other surrounding tissue, or blood clotting conditions, have had knee surgery in the past 6 months, not including surgery for obtaining a cartilage biopsy or a surgical procedure to prepare your knee for a MACI implant, or cannot follow a doctor-prescribed rehabilitation program after your surgery. Consult your doctor if you have cancer in the area of the cartilage biopsy or implant, as the safety of MACI is not known in those cases. Conditions that existed before your surgery, including meniscus tears, joint or ligament instability, or alignment problems, should be evaluated and treated before or at the same time as the MACI implant. MACI is not recommended if you are pregnant. MACI has not been studied in patients younger than 18 or over 55 years of age. Common side effects include joint pain, tendinitis, back pain, joint swelling, and joint effusion. More serious side effects include joint pain, cartilage or meniscus injury, treatment failure, and osteoarthritis. For more information, please see full prescribing information at MACI.com.